I'm Dr. Sohag Bose. I'm a practicing neurosurgeon in Asansol, West Bengal. Have been working in a setup where functional neurosurgery is being done. Okay, so my talk is on understanding epilepsy and the myths associated with it. So, what is epilepsy? Epilepsy is a medical condition when a person has, we can say, more than two unprovoked seizures. Hmm. Epilepsy can affect at any age. The dealing with epilepsy is early diagnosis and treatment. Early diagnosis and treatment can control seizures and potentially prevent its life-threatening consequences. What we should know is medications can stop seizures in about 70% of patients. So now what causes epilepsy? Some known causes include developmental abnormalities of the brain, infections that injure the brain, lack of oxygen to the brain, disturbance in blood circulation to the brain, that is maybe stroke or other vascular conditions, tumors in the brain, previous trauma such as brain injury, and genetic causes. Now, what are the symptoms of epilepsy? How do we know that a patient has epilepsy? The most visible sign of epilepsy is a seizure. Seizure usually lasts from seconds to several minutes. There are many types of seizures. Some are severe, some are subtle. So, severe seizures are very commonly. What we need to know is subtle seizures like absence seizures, partial seizures, which affect a part of the face. Sometimes a seizure will be widespread also. So seizures some of the symptoms or behaviors can occur during a seizure include convulsions. That is uncontrolled seizure when there is autonomous, uncontrolled movements of the body. There can be repetitive automatic behavioral such as chewing movements, decreased awareness of what, and the main thing is it is usually associated with altered sensorium, and usually it is followed by loss of consciousness. There can be a weakness in one of the limbs of the body, that is called Todd's paralysis. For seizure can be generalized. That is, it starts in one part of the body, and it is usually there is increase in tone and clonus. That is, it is called tonic-clonic seizure. There can be absence seizure, that is sudden altered sensorium or loss of consciousness. Otherwise, seizures can be partial seizures, that is seizures in one part of the body actually. So these are called partial seizures. Then, so these are repetitive automatic behavioral movements can be there, such as chewing movement. So these are very subtle signs, twitching of eyelids also. So these are the seizures which have to be picked up because these are subtle. So this is about the symptoms of seizure. There can be things like passage of urine, there can be passage of stool, there can be a tongue bite also sometimes, increased respiration also. This is usually followed by a loss of consciousness, and the person usually doesn't know anything about this episode. Now, coming to the main thing, which is widespread in the community, that is myths about epilepsy. This should be known by everybody. So, myth number one is epilepsy is contagious. Actually, it is not. It is not like any tuberculosis or even COVID. People are sometimes afraid of epilepsy patients. So, we should spread it in the society that no kind of seizure is contagious. It does not spread from one person to another person. Okay. Second is epilepsy is a form of mental illness. Although some epileptics may have a mental illness, there is no direct link between the two. So epileptic seizures are triggered by abnormal electrical discharges, not necessarily by the chemical imbalances that are known to occur in the brain of individuals who suffer from depression or other mental illnesses. So there is no link between any kind of a psychiatric disorder and seizures. So it should be very clear. Third is you can swallow your tongue during an epileptic seizure. So there are myths that when there is a seizure, if we put a hard object inside the mouth like a spoon. It can stop seizure, or put a slipper like a leather item near the nose. It will stop the seizure. So this is not. This doesn't happen. It doesn't have any scientific bearing. So this should be strongly discouraged. Third is epileptics it is said that epileptics are typically of less than average intelligence. Actually, if you see, it is just the contrary. Very notable intellectual figures like Julius Caesar, Socrates, Charles Dickens, even Napoleon, they were afflicted with epilepsy. There are documentation. So it is just the opposite. These are people who, if on drugs taken regularly, can lead completely normal lifestyle, like any of us. Then only children suffer from epilepsy. This is not. Epilepsy is can occur irrespective of age, sex, or religion. Both young and old suffer from epilepsy, and it is not peculiar to children. Third is epilepsy is caused by spiritual attack, or if the person is possessed by evil spirits. This was widely said so in the previous ages. So as we come through the times, now it is very clear that it is nothing to do. Some say that it comes with the new moon, or when there is no moon, there is some connection with the lunar cycle. This is totally a myth, and it should be dispelled, in very hard terms. Then epilepsy has no cure and cannot be treated. It is not a fact at all. Though, like hypertension, diabetes, and other chronic diseases, the patient has to be on drugs, a proper amount of drugs, and a normal, proper duration of maybe a long duration on drugs. But it can be totally controlled. And in some cases where there are operable causes, surgical causes like tumors, vascular abnormalities like maybe AVMs, fistulas, developmental anomalies, structural, that is causes, it can be dealt by functional neurosurgery. So epilepsy can be controlled surely, and it can be cured in maybe 10 to 20% cases when there is a structural cause for it. So I think the message which should go across is epilepsy is a disease which is non-contagious, and it can be treated if it is diagnosed early, and the patient is on regular treatment with proper diagnosis, that is with the EEG, with the MRI, and on if on proper drugs for a proper duration of time, can be totally under control. And all these myths with epilepsy should be dealt in a now there is a social media, through write-ups in the newspapers. It should be widespread in the society that all these myths are myths, and we can actually deal with epilepsy. Thank you very much.